Do you experience struggles around morning routines, getting to school, transitions, homework, mealtime, getting off screens, and bedtime? If so, you don't want to miss this episode.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, everyone, and welcome back to the podcast. I'm so glad that you're joining us today. And I'm really excited about my guest, Dr. Karrie Lager. Dr. Lager is a California licensed psychologist, parent-child interaction therapy and PC care therapist and trainer, and the founder of Healthy Focus Psychological Center in Southern California. Dr. Lager helps families reduce stress in the home using a therapeutic approach that fosters cooperation and loving family interactions, reduces disruptive behaviors, improves listening, and strengthens family relationships. I'm so glad to have her as a Child Nexus member and absolutely thrilled that she's here today. Dr. Lager, welcome to the podcast.
Thank you, Karen. Thanks so much for having me here.
I'm so glad. I've wanted to have you for a while. I think we talked last time at a luncheon and I said, I have to have you on the podcast to talk about this topic because, parents are concerned about their kids and their emotional dysregulation and mental health challenges, which I talked about in the introduction. And I just feel like parents are often don't have enough information about what treatment looks like, which treatment is the best approach for my child. And so I wanted to spend this year just talking about different treatment modalities. And by the time this one airs, we will have already talked about dialectic behavior therapy. And now I have you on here to talk about this approach, which we're going to mention in a couple of minutes. But, this is for parents who are concerned about defiance, tantrums, whining, hyperactivity, dysregulation, controlling behaviors, and they want more cooperative family interactions and they want better behavior from their child. And you know about this, don't you?
Yeah, absolutely. That's my specialty and my favorite kiddos and parents to work with.
So we're going to talk about PCIT specifically. I'd love for you to kind of explain to parents who might be listening what that is. And then we can jump in from there.
Sure. So PCIT stands for Parent-Child Interaction Therapy. And PCIT was originally developed by Dr. Sheila Iberg. It's been around for a long time. It's an evidence-based treatment, and it's designed to strengthen the parent-child relationship, reduce disruptive child behaviors, like you mentioned, such as tantrums, whining, not listening, and to lower parenting stress, which is so important when we're talking about helping kids with their social emotional health.
It's absolutely important because we know that when parent stress goes up, the dysregulation gets worse for kids. And, when I'm meeting with parents and they're telling me that they have struggles around a number of different things. Morning routines is a big one. Getting to school, getting homework done, bedtime is another struggle period. And it sounds like this approach is good for parents who are dealing with those types of struggles as well.
Oh, absolutely. Yes. So when we support parents and coach them in parent-child interaction, our goal is to take what they're learning in the therapy session and be able to use those skills in the most difficult moments. And those typically are exactly what you were speaking about, getting ready in the morning, mealtime, homework time, siblings, getting them to get along together, as well as turning off technology can be a challenge for many families too.
Absolutely. Absolutely. And so you talked a little bit about kind of the background with PCIT. So, a parent who's saying, this sounds like what I need. I'm having these struggles. I'm seeing the defiance. I'm seeing the tantrums. I'm seeing the whining. Again, the dysregulation in the home, which is creating a lot of stress. And they say, I think this approach might be good for my family. How does PCIT work? If they wanted to know, what does that look like?
Great question. So PCIT is very unique in that the therapist coaches the parent in real time. The therapist suggests words to say, actions to take to help with more cooperative behaviors, more fun, joyful family time, as well as what to do during those more intense moments when the child is maybe struggling with some dysregulation.
And so when you say that it's in real time, so can you talk about what that looks like? Do they have an earpiece? Is there how does that work?
Sure. Great question. So back in the day, before telehealth was super popular, it was often a one-way mirror, and the parent would wear a little hearing device, and the therapist would coach the parent while the parent and child played together. And we were transparent with the child, so they knew that the parent was learning new parenting skills to really have more joyful, cooperative family time. So it was transparent, but the therapist got to coach the parent in the moment. And now with technology and Zoom and other telehealth platforms, that we are able to actually go into the home and set up telehealth where we can coach through the computer, and which is even more powerful because we get to see those real-time behaviors, such as we can even practice during mealtime or cleanup time. So it's really effective to be able to go into the home.
And I can see how that would be extraordinarily helpful, because oftentimes parents will say, well, they behave differently when we come to your office than they do at home. and the therapist sometimes doesn't see the behavior in the office, but it's at home where those behaviors are really manifesting. That the therapist can really help and support the parent.
Definitely. And we often start with the skills during just playtime because we want it to be a little bit easier for the kid. We want the kid to be having fun. We want to work on the parent-child attachment and the bond, and also give the child an opportunity to show off that they can do it during playtime, that they can be cooperative. And it helps the parent practice these skills in a very easy way. And then we start to translate them into the more difficult areas when we do have to get the child to follow the parent's lead, like clean up or put on their shoes, things like that.
And it seems like that would be really empowering to parents as well, to be able to have this real-time experience and then see the outcome that is different than what they may have been used to seeing. And like you said, it's about wanting that more joyful and cooperative home environment and that peace and home in the home environment.
Yes. And the cool thing about doing it in the moment is the therapist is kind of an outside observer and can notice, like, oh my goodness, your child is smiling when you are using these skills. They really want to have this cooperative interaction. They love spending time with you. So it's so powerful to be able to point that out to the parent, because sometimes when there's intense dysregulation and quite a bit of defiance, the parent is having a hard time seeing past all the negative behaviors.
And so I think we mentioned this earlier. We did mention this earlier. Some of the defiance, the tantrums. Are there other behaviors that PCIT can really help with?
Yes, definitely. So we work with kiddos who might be having typical developmental challenges. So we know it's typical for young children to have tantrums or be defiant at a time. So oftentimes I like to tell people the kiddos I work with are the ones who are tantruming in the grocery store because they can't get any all the sweets that they want, or the 4-year-old who is dawdling at bedtime and kind of putting bedtime off. And we kind of look at why that might be happening. Is there some fears around bedtime, some separation anxiety? as well as just, defiance, not wanting to fear of missing out. So we help coach parents through things like dawdling. And then also meltdowns, definitely around technology, can happen. And we work with even severe aggression, kiddos who are biting, spitting, throwing things, cursing. So we really support the whole range of child behaviors.
That is just wonderful.
Yeah.
And I think about how this can also help improve sibling and peer relationships as well, because children are building those skills.
Oh, absolutely. So it's very sweet because we use a lot of positive communication. And so we help the parent notice when their child is being kind and sharing and gentle. And it's very sweet because you'll see the kiddo turn around and then start praising the parent, like, oh, thanks for sharing with me, mommy or daddy. And then the parents will say, oh, yeah, we overheard our child doing that with their sister or brother or even peers at school. So, and who doesn't love being around other people who are positive? So we're really teaching the kids how to notice the good in others and to really connect with others.
That is so lovely. And again, it's such an important skill for children to learn. That self-awareness that you're speaking about, like noticing their own behavior, but also noticing parent behavior, and then also better self-regulation skills as well. Now, you mentioned, tantrums in the grocery store, which makes me think of really young children. Who is right for PCIT?
Yeah, that's a great question. So PCIT was originally developed for children ages 2 to 7 years old, and it's been extensively researched with that age. And more recently, it's been used with toddlers, and then it's obviously tailored to be developmentally appropriate. And occasionally, you can also use it with kids who are a little bit older than 7. And with that, you would just tailor it to make sure that the child felt comfortable with the skills and they were confident in why the parent was using these new skills. And so if it is outside the age range, we adapt it and make sure it's comfortable to the child and the parent.
Wonderful. And so it sounds like it started with younger children, but then it can also go up. So the top of the age limit would be how old would you say?
I know some people who have done it like 10, 11, 12.
Mm-hmm.
I think that the challenge is you're coaching the parent what to say. So sometimes an older child gets a little annoyed. Well, she's just telling you to say that. So but the same concepts and skills have been used and researched and are based on child development and theory. So they're very powerful skills. They might just have to be taught a little bit different way or coached a little bit different for an older child.
Right. And, some of the behaviors that you talked about, a lot of these oppositional behaviors and defiance and tantrums, again, can be seen in kids who don't have a learning or a thinking difference. But, we also see those behaviors in kids with ADHD, with autism. And so do you work with children who will have a formal diagnosis and those who do not, it sounds like?
Yes, thank you so much for mentioning that. Yes, so PCIT can be adapted to work with children with ADHD, with learning difficulties too, learning differences, as well as with children on the spectrum too.
And it seems, one of the things that really stood out to me is that difficulty with navigating devices, because parents are saying that is such a struggle right now.
Yes.
Particularly after emerging out of COVID, when a lot of kids had a lot of access to screens. I think of even the really young ones where their parents are working from home and they're giving them their screens to keep them occupied. And now we're trying to pull back. And
yes.
I'd love for you to share some techniques that have been helpful. Obviously, it's going to differ depending on the child and the home environment. But what are your thoughts on how to address that with young children?
Yeah, absolutely. Definitely. And so really looking at the child's age and how they respond to technology. So some kiddos easily get sucked in to technology and almost have a meltdown because their reward center is lighting up when they are on the screen, and then you shut it off and it's like, boom, you get this big, intense meltdown. And so I think knowing your child and what works for them, the amount of time that's on the screen, what time of day they're on the screen. So if you're having a lot of dawdling at bedtime, but you are letting your child watch TV or play a video game up until the last minute of bedtime, we might help you adjust that of when they use screen time. So it's little tweaks like that. And then as far as managing screen time, having a plan. The therapist and parents can meet together and develop a plan of how much screen time and when, and make it work for that family. And then how to manage when it is time to shut off the screen, how to give transitions, how to be calm and matter of fact and consistent, to not give in, right? Because that's one of the biggest challenges, because some parents, they're exhausted, or they're like, oh, well, he's tantruming and I have one more email to give. Okay, I'll just go ahead and let him play for a little bit longer. And that one email turns into 10 emails the parent has to send. So these are things that, a PCIT therapist works with the family to figure out a plan that makes sense to them. I want to add the unique component about PCIT. It's very play-based. So we are encouraging families to get back to play. Screens are fine, right? But we've kind of fallen out of the habit of play and being interactive, and really focus, turning off the screens, turning off the TV, and just getting creative, connecting with your child through play or even art. And so in PCIT, we ask families to spend at least 5 minutes a day one-on-one with their child playing and practicing these skills. So it can actually make kids fall in love again with play, and maybe some alternatives instead of just screen time.
And I think that's such an important point. And it seems like that alone, even though PCIT is incredibly helpful and impactful in families and in reducing a lot of these problem behaviors, but that one-on-one time, that play time away from screens in and of itself is so valuable, because I think that, the screens have been a replacement for play and other non-screen activities. And we know that screens are also contributing to dysregulation and anxiety and depression. And so again, and particularly when you're working with kids who are so young, you're actually helping to model some more appropriate, behaviors around screens.
Yes, definitely. It's so important to establish that habit and that moderation early on. So that they're not the college students staying up all night playing video games, or, it's so easy to get sucked in, even as an adult, even as myself, to social media too. So it's a good habit to have some moderation early in life.
Yes, absolutely. And, one of the things that parents often think about, okay, so I do this treatment, I'm seeing all of these benefits and these changes in my home environment. There's more peace, there's more calm. My kids are interacting with more play. They're getting along better with their siblings. How long does this last? Following up, first of all, how long does the PCIT treatment program last? And then how long can parents expect the benefits of treatment to last?
Right. Wonderful questions. So typically PCIT is about 14 to 20 coaching sessions. So PCIT lasts anywhere between 14 to 20 coaching sessions. And it's really based on the parents mastering the PCIT skills, feeling very confident, consistently using them, spending that one-on-one quality time every day together, as well as when we see improvements in the child's behaviors, then we know it's time to graduate the family. And then as far as how long the treatment gains last, so it's interesting. There's been research that shows that PCIT is proven to reduce disruptive children's behaviors and decrease parenting stress. And there's also research that shows the treatment gains can last for up to 6 years after treatment is completed, and possibly longer. They just haven't done the studies for longer periods of time.
That is very encouraging to parents to know that, this is not something that's just going to work while they're in these 14 to 20 coaching sessions with you, but as they develop that mastery and those skills, that this will have long-term implications for their child and their family.
Yes, long-term. And I've had families tell me in different words, but that this program was life-changing for them.
Mm-hmm. I've heard that from families as well.
Mm-hmm.
So, parents who are listening, any additional tips that would help them to create more calm, more compassion, and, more creativity? Any thoughts on how they can do that in their everyday lives?
Sure. Yeah. I think the key is to remember that parents are experts of their family, of their children. Children also know kind of who they are, and they're each so unique. So it's really figuring out what your child and family needs, and really how to recreate that connection, how to recover after a difficult moment. And PCIT really gives parents the tools and empowers parents to bring out the best in their children. As far as additional skills, I think one of the most challenging thing about some of the severe emotional dysregulation, the tantrums that maybe last, 30 minutes up to 2-3 hours, is really exhausting for the parent. So really to encourage yourself as the parent to have kindness and compassion to yourself, to recognize this is difficult and that you can do hard things. You guys can get through this. So, I think it's important that parents are confident that they can connect with a team to work through this. And then also, it's really important for the parent to have their own support system so that when they are in the moment, the parent can't, model how to be calm, how to be compassionate, how to be consistent and follow through. And in a way that sets boundaries to encourage the kid to have healthy, respectful relationships. So I'd say one of the biggest things is just adding a lot of kindness and compassion to for yourself as the parent, but also understanding this is hard for your child too, and there's something behind the behavior, and that you're there to help your kiddo get through it.
Wonderful. Dr. Lager, thank you so much for being here, for sharing this information. How can people connect with you to learn more? Because I can imagine parents listening and thinking, this is something I want to try. This is something I think will be helpful for our family. What is the best way to connect with you?
Sure. Thanks, Karen, so much for having me. Probably the best way to connect with me is through my website. That's drkarrie.com, drkarrie.com.
Wonderful. And we will put a link to that website in the show notes. Thank you again for being here and for sharing your work and your expertise with our listeners.
Oh, my pleasure. Thanks for having me.
I hope that you learned a little bit more about parent-child interaction therapy today, and maybe it's their first time hearing about it. And I hope the information was helpful. Thank you so much for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.